Yeah, if you look at me, yeah, and if you try to incorporate the question with the answer, so if I say, what are the health and social care issues, you start off by saying the main health and social care issues are. Okay. So if we start with your name, please.
My name is Khalid Farooq.
Thank you. And what are the main health and social care issues that you and your community face?
A main health and social care issue within the ethnic minorities are language gap, cultural differences, religious differences, and due to that, services not integrated properly into the ethnic communities. Like if the lady, she is unconscious, so in Islamic culture, lady should be treated by the lady or the madam, like only with the husband, nobody else touch the lady, So due to that differences, the male staff is gonna go there, and the lady, surrounded by the family, they all male there. If the, that's health and safety people, that's medical staff willing to get the access to the lady body, that's gonna be a bit embarrassment to the family. If the son's theirs, husband theirs, and other relatives there, so they're gonna get shy. So that should, this health awareness should be given to the all medical staff, and and the ladies on the car, they can undo all the dress, and they can treat the lady, and they can, do the CPR and other stuff. And same time, culturally, our people, they depend on each other. If they got serious diseases, they don't tell anything. Like the men's, they even don't communicate to their wife or to the children. Even especially, they don't let the children know they got some diseases. So that's why culturally we should know about that thing, and we should make that thing easy for these people. And the issue on the different issues on the language-wise, these people are not a good reader or not, good understanding. They haven't got good understanding to the English. So the literacy rate is very low. So we need to provide some sort of system where they can understand the services, NHS, and new health champion stuff into their own languages, or the communication, even they are not good reading in Asian languages. So we should make some audio or video files, like this thing is very good, but if this thing is still in English. So I was thinking if you can allow me to say something in Urdu or Punjabi or Hindi, so that people can understand that thing what I'm saying. So that sort of stuff we need to get to resolve these issues.
Okay, brilliant. And how can Healthwatch help to address these issues and concerns?
Yeah, Healthwatch should, to try to reach to the end consumer, because they all are consumers. And as a consumer, Healthwatch job is to provide the services to the everybody. Well, like I was reading the research paper about the postcode lottery, I was debating on the other room. Like, this was national health policy to get the diabetic screening to the 40 to 50 years old all population in UK. But what happened, the medical people, they got the MIR scan for the rich postcode people, and they left the densely populated Asian areas. They didn't done it, and that's why they've been discriminated just for nothing. So that's why the research paper was, saying, if we made a policy, we should implement the policy with the full spirit of it. The benefit should go to the grassroots levels people, because they all taxpayers' money, and the advantage should go to the end user of the NHS. So to overcome these issues, we should let the the ethnic minorities people be recruited from them and encourage to them. They come into the services, and we listen to them, and we should do some workshops or integration inside to the Healthwatch. And same time, like this thing is going on is very good, because you reach to the end users, to the communities. But these things need to be done quite oftenly, so the people can express their feelings, and you learn from that feelings, and that things can be implemented back to the people, and the patient should be educated which sort of disease they got, and what the treatment they had, and what's the prevention they need. So in this way, the load to the NHS is going to go less, because people understand what is sort of medication they need, and they're going to look after through the preventions.
Okay, and What is the best thing that Healthwatch could do for your community?
The best thing they can do, they run some seminars, and there's like some sort of Asian melas coming in every big towns, like Bradford Mela, like Eastmead Mela, Slough Mela, Southampton Mela, wherever the big Asian communities. On the Asian melas, if the Healthwatch put their desk there and let the people know, yeah, into their languages and to recruit the Asian staff or the staff, yeah, targeted on their languages, and they let the people know they don't need to hide anything. If they got some diseases, there's a medical staff there, medical help there, Healthwatch is there, and they should show their concern to them, and they should help help themselves. Yeah, when they're letting somebody know, they're helping themselves, and that's medical staff going to treat them. So the main thing is let all the issues out from the community and discuss and debate through the Healthwatch channels, and then integrate back to the community.
Perfect. And what will Healthwatch have to do to engage you and your community so that you can give your views about health and social care?
Yes, health and social care wise, like I was saying, yeah, our community is not much aware.
Could you just do that again, because we're going to be cutting the interview up. You said, as I said before, we may not have that business. So if we could, not say that up. Yeah, sure. What will Healthwatch have to do to engage you and your community so that you can give your views about health and social care?
Yes, Healthwatch could do something more like these Asian people, they got different culture and language barriers and learning difficulties. Even some patients, they got severe mental diseases, and they never let anybody know what's going on into their brains or heart. Like some our people, they are 50, 60 years old, they got dementia. So the people don't know aware that the young people thinking their elders are, just like a waste of space. They are, understanding it, and these dementia is very highly going on into the older age of the first generation came here in UK, and we need to let these people to be treated properly so they can live life as a good British citizen, and they cannot go to the isolations and to the lonely. To do that, we need to let the language barriers lifted up for them. And same time, if we could recruit some more ladies from these Asian backgrounds or ethnic minorities backgrounds, like we say, we are 10% of the UK populations. So in the healthcare, we are less than one, not even 0.1%. So if we can get that percentage done, we can done the surveys, and we make the health services ready for futures. We should do the texting services for the whole of UK, because we got the all patient data, so we should utilize that data. We should text them, because texting is free now. So if the patient got dementia, we should send them message in Hindi, if the person is Hindi or Urdu or Punjabi or Kashmiri, send them message on that language through the Google Translator. You put in the English, and it's Google going to translate into Urdu, and you're going to send that patient, here's your guideline, you're getting that sort of disease, and you should prevent from the actions, take your medication, send the text all the time. So that patient does, million of patients are billions, that's 7 billion, we are in the 70 millions only. So we should, send the messages to these people individually according to their treatment, So that's future services we should be launched here. So in this case, it's going to be a less cost effective as well, and the text message is going to different languages through the help of the Google Translation, these free services. So you can translate into 160 languages, and that's all we need to link all the patient record to the centralized data bank, and centralized data banks, according to each patient, send them reminders all the time, and that's going to be help the, I think, future health watch, and same time all the end user consumer going to be get benefited out of it. Yes.
Brilliant. Last question. If Healthwatch was successful, what would it look like? How would you like it to work, and what do you think it could do for you?
Yes, if the Healthwatch is successful, I'm thinking, yeah, I'm going to be a more proactive citizen. I could bring something back to to my community, and same time I'm going to be a very active member of the community. So to bringing that things, I think is Healthwatch should go to the every individual, like the text idea we put it inside. So same sort of these ideas we have to combine it with others put from the different peoples, and we have to make a IT based, so that communication are cheap, text messages are free. Even I got unlimited text, I can send a million from my mobiles. So in the computers you can make it free text message. So we should utilize the technology, and the Healthwatch is just like a technology mother for all, where the people are not sitting there with data integrated to the Healthwatch, and the Healthwatch is an IT system, and IT system, yeah, just linked to the all patients' data and sending them the text messages to their home numbers, the text to speech in Urdu, yeah, text to speech into the English or into Punjabi or into Hindi or into Kashmiri, and that's the way, you know, I mean, you don't need even the mobile numbers, every household numbers, we can send a text to speech messages to them, and the IT is not going to discriminate anybody, because the system, yeah, going to link to the central IT stuff. The Healthwatch is going to deal with that system to everyone's. Educating people is more important. When the people are educated, they're going to get preventions. And when they're going to get prevention, they're going to get able to understand which sort of disease they had and which sort of prevention they should carry on all the time, and the medication they should take that. So I'm thinking the future Healthwatch is going to be a IT based, and the IT base is going to be a mother of all the patient, and is going to treat every patient equally. It's not going to be like the postcode lottery like before happened. It's like for the poor peoples, yeah, like the people never use these services, so there are people getting treatment at their homes. So that's why I think it's going to be a good, have to be a IT based Healthwatch system, yeah. That's what I can see.
Brilliant. Thank you very much.
That's right.
That's great. You're right there.
I can't put my hand.
Trying to hold it in, aren't you?
It's been 15 minutes now.